my name is Curtisa Williams, and this is
Nino Yabut.
So I'm recording this presentation as part of the deep tendon reflexes for a nursing skills course for Nightingale College. So Nino Yabut, do you understand and consent to the following? Participation in the skills demonstration and being recorded for internal educational purposes, and including grading and program reviewed by faculty and institutional accreditors.
Yes, I consent. And I understand.
Okay, perfect. So I'm going to begin my skills video. So I'm just going to perform hand hygiene. I'm going to enter the patient's room, draw the curtains to ensure privacy. Hi, Mr. Yabut. I am Curtisa, and I will be your nurse for today. Can I just please check your ID then? Okay. Can you verify your name and date of birth for me?
Nino Yabut, February 14, 1991.
Okay. So I'm here today because I'm going to perform your deep tendon reflexes. Is that okay?
Yes.
Okay. So usually the deep tendon reflexes, this is a test that allows us to examine how well the spinal cord and the peripheral nerves are functioning. And for pregnant patients, this test allows us to assess for any presence of elevated reflexes or hyperreflexia, which can be a sign of a complication of known as preeclampsia. Also, we do check for deep tendon reflexes if we are giving a medication such as magnesium sulfate. We usually give this medication in pregnant patients to help prevent seizures. So magnesium sulfate, it works by, it slows the neuromuscular system. And one sign of magnesium toxicity can be diminished or absent reflexes. So for pregnant patients, as much as possible, we would like to assess for any presence of elevated reflexes or hyperreflexia, as well as absent or diminished reflexes, depending on the clinical situation. Okay, so when we grade the deep tendon reflexes, we usually grade it from on a scale from 0 to 4. So 0 meaning no response, 1 plus is diminished, 2 plus is normal response, 3 plus is brisk, and 4 plus is very brisk. So when I will be grading my patient as I go along, I would say 2 plus normal in the real world, and symmetrical bilateral on both sides. Okay, so I'm just going to make sure that my patient is in a comfortable position. He is not tense, his muscles are relaxed, and I'm going to start. So yeah, I'm going to start with testing his bicep reflex. So first, I'm just going to support the arm. So I'm going to ask my patient to please relax. And I'm going to support, I'm using his right arm, so my left hand will be underneath the elbow. And I'm going to locate the bicep tendon, place my thumb, and I'm going to tap my hammer against my thumb. So a normal response would be flexion of the forearm. So we're going to test. Okay, so that was a 2 plus normal response. I saw flexion of the forearm. So next I'm going to test for the tricep reflex. So I'm going to assist my patient, and I'm going to support the arm. So I'm going to have him position him in a 90-degree angle. Okay, so we're going to position your arm in a 90-degree angle. I'm going to ask him to relax. So just relax. And I'm locating the tricep tendon. So this is usually slightly above the elbow. And once I locate it, I'm going to tap it with my hammer. So a normal response would be extension of the forearm. Okay, so I'm going to tap. Okay, so we have extension of the forearm. So that means it's a 2 plus normal response. So I'm going to move along and I'm going to test my patient's patellar reflex. This is also known as the knee-jerk reflex. So ideally we want our patient to be sitting in a comfortable position, relaxed. My patient is relaxed. So to locate the patellar reflex, it'll be slightly below the patella. And a normal response we'd like to see, it'll be extension of the lower leg. So locate the patella, locate the tendon, and I'm going to tap with my hammer. Okay, so that was an expected response. We saw extension of the lower leg. That was 2 plus normal response. So moving on, I'm going to test my patient's Achilles tendon. So for this, I'm going to ask my patient to relax. He's dangling his legs. So for the Achilles tendon, I'm just going to gently dorsiflex the foot, as so. And then I'm going to locate the Achilles, and I'm going to gently, I'm going to tap the tendon with my hammer. And an expected response would be plantar flexion of the foot. So I'm going to tap, okay, and that was a positive response. So we have a 2 plus normal response of the Achilles tendon. Lastly, I'm going to check for ankle clonus. So for ankle clonus, I'm going to support the lower leg, and I'm going to sharply dorsiflex the foot. And an expected response would be foot drop or no presence of rhythmic movements or jerking. And if my patient is positive for clonus, that would mean we would see a presence of jerking or rhythmic movements. And this can indicate presence of hyperreflexia or a neurological impairment such as preeclampsia. So I'm going to go ahead and test my patient for ankle clonus. So I'm supporting the lower leg. I'm going to sharply dorsiflex the foot. And okay, no presence of rhythmic movements or jerking is present. So no ankle clonus is present. Okay, so that will be the end of our test. All of your results were normal. Do you have any questions for me?
No.
Okay. Are you comfortable right now?
Yes.
Do you need anything?
No.
Okay. So here's your call light. If you need anything, just let me know. I'm going to perform hand hygiene, and I'm going to document my results, and that'll be the end of my skills video. Thank you.